A steady increase in North Texas COVID-19 cases has caught the attention of local health experts. Their biggest concern is that the current COVID vaccine may not be able to fight a new variant as well as it fought previous strains. Alex Boyer live tonight with what infectious disease doctors are most worried about. Alex.
Yeah, hi, Steve. I talked to a top researcher today who tells me he's really worried about this new B.5 variant, specifically because it's highly transmissible and also it's responsible for several breakthrough infections. You know, pharmaceutical companies are now working to develop variant-specific vaccines which may be more effective.
These kinds of subvariants were always a possibility.
The White House COVID-19 response team is warning Americans about a new, highly transmissible subvariant, BA.5.
We know that as the virus continues to evolve, our response and guidance must evolve with it.
CDC Director Dr. Rochelle Walensky says BA.5 is a variant of the original Omicron strain. BA.5 now represents 65% of all new COVID infections. The latest 7-day average shows hospital admissions have doubled since early May, though still well below peak levels in mid-January. 32% of the country is living in a high COVID community level, represented by orange, and 42%, including Dallas County, is living in a medium COVID community level, represented by yellow.
Currently, many Americans are under-vaccinated, meaning they are not up to date on their COVID-19 vaccines.
Currently, only Americans over the age of 50 or those with underlying health conditions are eligible for a second booster. Dr. Anthony Fauci says there's no timeline as to when that could change.
And in this case, it's a regulatory decision on the part of the FDA, and the CDC will examine it with regard to whether or not they'll recommend it or allow it or what have you.
But top researchers say the current COVID vaccines and boosters don't appear to offer much protection against BA.5.
You are still actually at risk of catching BA.5. It's different enough that it escapes some of that immunity. This seems to be a lot more severe in hamsters. It causes a lot more hemorrhage in the lungs, a lot more sort of bad things, infects more cell types more efficiently.
Dr. Benjamin Newman is chief virologist at Texas A&M. He says more breakthrough cases are being reported.
It is a worrying development.
Newman says the test positivity rate is as high as it was in January during the record Omicron surge, but he says BA.5 cases are underreported due to an increase in home testing.
We know that it's bad. We know that hospitalizations are rising and cases are rising. We're still in the early stages of this new outbreak, and we know the wave's coming. We're not sure how high it's going to be, but it doesn't look good.
And medical experts still recommend getting fully vaccinated and boosted if you have not done so already. And if you become infected with BA.5, the CDC director recommends talking to your doctor, asking them about the oral prescription. It's an antiviral called Paxlovid, and it's been shown to reduce the risk of hospitalization and death of COVID-19 by some 90%.